You know, for a person to come up to a clinic to be tested, some don't feel it's ideal enough. They won't come. But the idea of following them in their own phone is really helping them much. And a lot of people are being helped in that way. And we are seeing a positive change. And the counseling that they are going through also is making an impact.
So these people are doing a lot in our communities. Sensitization for obesity and other things about HIV.
So hii program ni tipeleka pasogolo maningi ifokondwera na ma communities yonse ita benefit muleli ya mini program akapita mu makomboni akapeza muntu bamutya counseling bwino abula clinic man tamanji tangaratiri tilipa open. So hii program njere moze tandiza bintu babwino kwa moyo watu.
Where we've not been able to manage as a facility, they've gone down there and basically they've been able to go into the communities to just do the testing there, whereby, you know, we are busy as a facility, so it's been difficult for us, you know, to access certain places, but they've done the work on our behalf.
Lusaka is the capital and the largest city of Zambia. It is one of the fastest developing cities in southern Africa. It is the center of both commerce and government in Zambia and connects to the country's 4 main highways, heading north, south, east and west. Lusaka is one of the cities with a high HIV prevalence rate in Zambia. Most of those at risk of contracting HIV do not have access to HIV counseling and testing, therefore do not know their HIV status. DAPP, in cooperation with CDC and the Ministry of Health, has embarked on a test and link campaign in some of the high HIV prevalent areas in Lusaka. The Total Control of the Epidemic TCE program is implemented in Lusaka District, Lusaka Province in Zambia, in response to the sweeping HIV and AIDS epidemic. Total Control of the Epidemic is an innovative grassroots one-to-one communication and mobilization strategy for prevention and behavior change. The main idea is to have an informed dialogue with each individual in the comfort of their homes so that they can take a stand to reduce the risks of HIV infection. TCE in Lusaka conducts an aggressive test and link program, and during the first year of the program of April 2015 to the end of March 2016, 107,000 people were tested for HIV. The main focus was on people regarded to be high risk of contracting HIV, namely commercial sex workers, men having sex with men, women, adolescents and young girls. All the people who tested HIV positive were linked to health centers for further diagnosis so that those eligible for ART were enrolled. The HIV testing kits were collected by the TCE field officers through 3 health facilities in the targeted areas.
In this program, we are also looking at the key population. With the key population, we put them into 2 categories. There's what we call the sub-key population and the priority population. On the key population, the program or the project is focusing on, 1, the sex workers. We have a program of reaching sex workers with HIV prevention messages, and those who are HIV positive, we have the issue of referring them to the nearby facilities for them to access treatment. Then we have the transgender. The transgender is a person biologically born a male but to represent himself as a female. Also, this is one of the group which is more vulnerable to HIV and AIDS. We are also targeting them through the field officers, reaching them through the door-to-door. Then we have also the MSM, that is men having sex with men. Also, they are part of the population as key population that we are looking at this year to make sure that we also reach them with prevention messages and also with care and support messages. Those who are HIV positive, they will be tested and referred to the nearby facility for them to access treatment.
The area covered in Lusaka are in high-risk suburbs around 3 health facilities, namely Mtendere, Kamwala and Kabwata, with a population of 323,000 people. 90 field officers were recruited and trained and worked in 3 groups, trios, to support each other and conduct coordination meetings on a daily basis. Strategies used. The project reaches out using different strategies such as one-on-one counseling and testing, peer-to-peer strategy where men mobilize other men through their age groups. When one has been tested, will mobilize others for HIV testing. Field officers use weekends to target men who are not found at home during working days. Evening home visits also help to target those that are normally at work during the day. Workplaces such as markets, bus stations are targeted during testing campaigns to reach out to more people. Studies compiled from the 3 facilities in Lusaka show that HIV prevalence is highest in the age groups of 25 to 49 years for both males and females. HIV prevalence is slightly lower among females aged 25 to 49 years compared to their male counterparts. The lowest HIV prevalence was recorded from the ages of 5 to 9. The overall result of the first year of testing was: total number of people tested for HIV was 106,809,000 from April 2015 to the end of March 2016. 52,763 males and 52,046 females, so almost half male and half female were tested. 46,967 people were tested for the first time with the TCE program, or 44% of all the people tested. The number of couples tested for HIV were 12,209, or 24,428 individuals, or 23% of the total number tested. Total number of people who tested HIV positive were 10,114. The overall positivity rate was 9.5%. Number of people linked to care treatment and support was 9,134 people, or 90% of the people that tested HIV positive. DAPP Zambia wishes to continue with the Humana People to People TCE program in support of the 90-90-90 targets set by UNAIDS to end the epidemic by 2030.